Have you been prescribed Ordipha 500 and wondering what it actually does? Is it a powerful cure for every infection, or is there something your doctor may have forgotten to tell you? Stay until the end, because one common mistake with this antibiotic could make future infections much harder to treat. Welcome to Medzy Health. In today's video, we'll explain what Ordipha 500 is, how it works, its uses, dosage, side effects, precautions, and whether it's the right antibiotic for you. First, what exactly is Ordipha 500? Ordipha 500 contains Azithromycin 500 milligrams, a macrolide antibiotic used to treat certain bacterial infections. It works by stopping bacteria from making the proteins they need to grow and multiply. As a result, the bacteria die, allowing your immune system to clear the infection more effectively. But here's something very important. Ordipha 500 does not work against viral infections. If you have the common cold, flu, most sore throats caused by viruses, or viral COVID-19, this antibiotic will not help. Taking antibiotics when they're not needed can contribute to antibiotic resistance, making future bacterial infections more difficult to treat. So, what conditions is Ordipha 500 commonly used for? Doctors may prescribe it for bacterial throat infections, certain ear infections, sinus infections, chest infections, such as some cases of bronchitis or community-acquired pneumonia, skin infections, and some sexually transmitted bacterial infections, depending on local treatment guidelines and the type of infection. Now let's talk about dosage. The exact dose depends on the infection being treated, your age, kidney and liver function, and your doctor's instructions. Many adults are prescribed 500 milligrams once daily for 3 days, while other infections require different schedules. Never change the dose or stop treatment early, even if you start feeling better. Stopping antibiotics too soon may allow some bacteria to survive, increasing the risk that the infection returns and contributing to antibiotic resistance. Now, here's something many people don't know. Certain medicines and supplements can affect how azithromycin works. For example, antacids containing aluminum or magnesium may reduce its absorption if taken at the same time. It's generally recommended to separate them by a few hours if advised by your healthcare professional. Let's talk about side effects. Most people tolerate azithromycin well. Common side effects include nausea, diarrhea, stomach pain, vomiting, headaches, and sometimes changes in taste. These are usually mild and improve after the treatment is finished. However, although uncommon, serious side effects can occur. Seek immediate medical attention if you experience swelling of the face or throat, severe skin rash, difficulty breathing, severe persistent diarrhea, yellowing of the skin or eyes, or symptoms of a fast, slow, or irregular heartbeat. Who should be careful before taking Ordipha 500? Tell your healthcare provider if you have liver disease, heart rhythm problems such as QT prolongation, low potassium or magnesium levels, myasthenia gravis, or if you're taking medications that can affect heart rhythm. If you're pregnant or breastfeeding, discuss the risks and benefits with your healthcare provider before taking any antibiotic. Now let's answer the biggest question. Is Ordipha 500 an effective antibiotic? Yes, when it's prescribed for the right bacterial infection. Azithromycin has been used for many years and remains an effective treatment for certain infections. However, because antibiotic resistance has increased in some parts of the world, it may not be the best choice for every infection. That's why antibiotics should always be taken exactly as prescribed by a qualified healthcare professional. The bottom line is simple. Never use leftover antibiotics, never share them with someone else, and never take antibiotics for viral illnesses like the common cold or flu. Using antibiotics responsibly helps protect not only your own health, but also the effectiveness of these medicines for everyone. If you found this video helpful, don't forget to like, subscribe to Medzy Health, and turn on notifications for more evidence-based medicine reviews. And if you want to learn the 7 biggest antibiotic mistakes that millions of people make, click the related video on your screen right now. Thanks for watching, stay healthy, and I'll see you in the next video.